So another concept or question that arises is what should you as the individual patient expect in an experience with a vein care clinic? A number of things actually. First of all, the care needs to be convenient and you shouldn't have to wait months and months for an appointment. At our practice, we can usually work somebody in within a week, often even the same day if we have a cancellation. And we work very hard to provide that convenience to the patient. We also recognize that patients have other aspects of their lives that are important, care for their family, other jobs, and other obligations. So we make every effort to fit into their schedule so the care is provided in a way that's convenient for them. Other things to look for are what is the background of who's caring for your veins? Is it even a doctor? Is the doctor board certified in a vascular specialty? In many vein clinics around the country, they are not. They come from all different manners of different practices and backgrounds, but quite often they lack any formal training in managing and treating vascular disease. In our practice, things are different. Dr. Park is a board certified interventional radiologist with extensive background in treating vascular disorders. In my case, I'm a board certified vascular surgeon, have been so for a long time, longer than I'd probably care to say, but approximately 30 years. And during that time, I've exclusively treated vascular disorders, including varicose veins. That type of expertise is important. It leads to better treatment decisions, better treatment outcomes, and a better overall experience for the patient. Varicose veins are a very common disorder. They're more common in women than men, but plenty of men get them as well. What are varicose veins? Varicose veins are dilated veins, and the reason why they become enlarged is that there are normally little one-way valves inside the veins that will open to permit the blood to go up the leg against gravity back to the heart. And then when the flow slows and gravity would otherwise push the blood backwards, the valves are supposed to close to prevent that. That's what's supposed to happen. With varicose veins, those valves have worn out. It's generally a genetic tendency. It's nothing that you did wrong. It isn't what you ate or what you wore, crossing your legs. There's a lot of mythology about that, but basically it's a genetic tendency where the valves degenerate and no longer perform their function. When that's the case, gravity being what it is, the blood will reflux backwards during part of the cardiac cycle. That puts pressure on the veins, a lot more pressure than what they're designed to withstand. And as a result of that, that pressure causes the veins to dilate. The pressure is transmitted into the nearby skin and soft tissue, causing pain, swelling, and all the symptoms that are associated with varicose veins. One of the main advantages in terms of deciding whether you have varicose veins is that for the most part, you can look at your legs and you can tell. Probably even a relative had them as well, which makes it a little bit more easy to sort that out. And unlike other disease processes or abnormalities where you have to get x-rays or blood tests and things like that, you can just put on a pair of shorts, look at the legs, and you pretty much know right away that there's an issue. And there's a lot of variety or combinations of problems that you might see with varicose veins. The larger ones look like big, bulging blue, almost like a sack of grapes under the skin. Those are pretty obvious, and most people will seek care before they get that large, but not always. Also, the veins may look like little squiggly worms under the skin, or broken veins is how it's often described. In addition to that, there's a condition called spider veins, or telangiectasias is the formal medical term, and they look like, as the name would imply, like spider webs, usually a bluish color, sometimes a reddish color, and they're just little spidery 1 millimeter or smaller veins that often occur in clusters and can be more of a cosmetic issue. And that's what usually brings those patients in to have treated. They don't like the way they look. We're in South Carolina, people are wearing shorts or dresses and dressing accordingly for the warm weather, and they want them gone. And so they come in and seek care for those as well. So whether it's because they're causing pain, swelling, or more of a medically oriented problem, or it's strictly a cosmetic issue, those are all valid reasons to have them evaluated and treated, and we see patients across that continuity and spectrum every day.